Hi everyone, my name is Alexis and I am a licensed speech-language pathologist at Long Island Center for Speech. I am the assistant supervisor at our Lake Success location and I work there full-time. Today I will be discussing one of my favorite topics, voice therapy. So there are different forms of vocal abuse and vocal misuse, which can contribute to contact ulcers, vocal nodules, polyps. I'm going to go over ways to prevent this today. Unfortunately, not all of this could be prevented, and if we can't prevent it, we have to be more reactive and implement voice therapy. And when we have to implement voice therapy, I will be going over various strategies that could help. So let's talk about the differences between vocal abuse and vocal misuse. So vocal abuse is a behavior that strains or injures the vocal folds, or vocal cords, however you want to call it. This may include excessive talking, throat clearing, coughing, inhaling environmental irritants, smoking, screaming, or yelling. Then there's also vocal misuse, which is improper use of the voice, which includes speaking too loudly or at an abnormally high or low pitch. So for example, if you're doing a character from your favorite TV show that's not natural to you, you're using your voice in an improper way and you can in fact damage your voice. So it's very important that we know the differences between vocal abuse and vocal misuse. There's various populations that are more prone to vocal misuse and vocal abuse. For example, teachers, actors, singers, coaches, basically any professional who uses their voice on a frequent daily basis. They're more prone to vocal nodules, vocal polyps, contact ulcers. Think about teachers. They're talking for extended periods of time to a classroom of 30 students. They're competing over background noise. Perhaps the window is open. The landscapers are outside the window. There's kids talking. They're competing against a lot and they're overusing their voice and they're abusing their voice. Think about a soccer coach yelling across a field over background noise or yelling to people, 50 feet away. Think about the strain you're putting on your vocal cords. So it's very important, especially for these professionals, to engage in vocal hygiene. Let me just go over what the vocal cords look like and how you could strain them, and then we'll go over some vocal hygiene in order to prevent the nodules or polyps from occurring. So you could think of your vocal cords as two rubber bands. As you raise your pitch, they elongate, and there's tension placed on them. Look at that. And as your pitch drops, they kind of fall and they're not long anymore. So if you're speaking with an increased pitch all day, your vocal cords are strained, they're tense. Vocal cords also move apart and together for breathing and voicing. So we also have to be able to coordinate breath and voicing at the same time. A lot to think about, a lot of things we don't think about when we speak and we take it for granted. So we'll be going over coordinating breathing and speaking at the same time. If we're running out of breath support, our vocal cords are going to be smacking together and creating contact ulcers, nodules, nothing we want. So vocal hygiene. First things first, keep hydrated. I am right now. I do so every day. I always have a big water bottle at my desk, and all my patients know that. Stay hydrated. Drink plenty of H2O. Anytime you feel hoarseness or dryness, take a sip of water. Hydrate those vocal cords. Don't let them dry out. Okay? And make sure you're using water. Coffee could be detrimental because it is highly acidic and it could dry out the vocal cords. So try to avoid foods or drinks that are high in acidity. Even gum, like spearmint gum, anything with the minty flavor, that could dry out your vocal cords, believe it or not. So make sure you avoid foods that are high in acidity because it can contribute to reflux, LPR, and GERD. Believe it or not, the reflux material moves up the esophagus, spills over in the larynx, and erodes the vocal folds. So think about that. They could become swollen and inflamed and contribute to that hoarse, strained vocal quality that we don't want. So let's go over drinking lots of water, staying away from foods that are high in acidity, Also, compensatory strategies. If you are a teacher, try to use a microphone or get closer to the person you're trying to speak to. Don't be competing against background noise. Don't be trying to speak over yelling students. Make sure you get everybody's attention first and get a little bit closer so you don't strain your voice. For coaches or personal trainers, they could use a whistle or a megaphone. Instead of yelling across the field, use your whistle and blow in the whistle to get people's attention. Why should you put strain on your voice and damage that voice? Use other modalities to compensate to get people's attention. Make sure you reduce the background noise. If you're in the house, don't be yelling from one floor to another to get somebody's attention. If somebody's vacuuming, do not be yelling over the vacuum. You are straining your vocal cords. Get closer to the person, reduce background noise. This will all, in turn, keep those vocal cords nice and healthy. Again, don't forget we're going over ways right now how to prevent vocal nodules, polyps, and disorders such as that. Another issue that could cause strain in the vocal cords is tension. A lot of people have a tense upper body and we don't even realize it. So a lot of times I'll start my voice sessions with relaxation exercises. So I'll go over some of those right now. I always start off my session with neck rolls and shoulder rolls. You could roll your neck to the right 5 times. You could roll your neck to the left 5 times. You could roll your shoulders forward, roll your shoulders back. Just release any tension in the upper extremities. Your vocal cords are housed in the larynx. They live in this larynx. Think about tension. If you're pushing any tension on them, they're going to be smushed. They're going to be smacking together. And again, causing lesions and swelling on the vocal cords. We do not want that. Another exercise I love to do are shoulder shrugs, because we're able to pinpoint the tension versus the relaxation. A lot of time this exercise makes patients realize, wow, at rest I'm really tense, or at rest I really have poor posture. Again, if we're tensed, if we're hunched over, think about how we're impacting those vocal cords. We want them to be moving apart and together, nice in a relaxed manner. So have good posture, be relaxed, and don't forget to breathe. So H2O and breathing is very important. Things that are key to our life. Water and breathing could help us with our voice. So make sure you are breathing to replenish those vocal folds. If we're not breathing and we're pushing past breath groups, we're going to cause the vocal cords to smack together. We don't want that. So before we go over some breathing exercises, I just want to show you some pictures of healthy vocal cords versus vocal cords with lesions on them. How vocal cords look like when you're voicing, how vocal cords look like when you're breathing, just so you have a nice little image. So these are healthy vocal cords. We don't see any lesions on them. They're open for breathing and they approximate and come together for speaking. These are contact ulcers. We see 2 lesions bilaterally on each vocal fold from them smacking together and becoming strained and inflamed. We see a polyp. That's unilateral. It's just on one side. And think about this. If you have a lesion on one of your vocal cords, could they close all the way to voice? They can't. You're going to have a blockage there. I'm going to show you another picture. These are so common. Nodules, bilateral vocal fold nodules. So your vocal cords cannot come together for appropriate voicing. You're going to have a lesion in the middle blocking. And it's going to cause a bowing or an hourglass figure of the vocal cords. Air is going to escape, causing a breathy, again, hoarse vocal quality that we don't want. It's also going to be hard for you to coordinate the speech and breathing. Air is escaping. We have that bowing of the vocal folds. We do not want that. So I thought these pictures were very helpful. And there's other issues as well. We have vocal fold paralysis, where one vocal fold will not move. And then we also have cancer that could result. But, the most common forms of vocal pathologies are the contact ulcers, the polyps, the nodules, or even I have patients that come in with inflammation from acid reflux or vocal abuse and misuse. And again, our vocal folds are housed right in the larynx. And this is what I'm going to go into next, diaphragmatic breathing. Why it is important to power your voice from the lungs and the thoracic cavity and to bypass the larynx and the pharyngeal cavity. Okay? So first things first, diaphragmatic breathing. You want to make sure your shoulders are relaxed. You do not want this clavicular breathing. You want to breathe at the level of the diaphragm in the belly. I tell my patients, imagine your lungs are balloons and you're filling them with air and then releasing. So keeping the shoulders relaxed, neck relaxed. We're going to inhale for 3 seconds, exhale for 6 seconds, hands on the belly. And we do a series of breathing exercises. So as a voice patient, I recommend before going out and speaking for extended periods of time, engaging in relaxation exercises, tension reduction exercises, and then some deep belly breathing. So that's what I recommend. Again, you do not want to run out of air. You want to take nasal inhales while speaking to replenish your breath support. If you're running out of air, you're placing tension on the vocal folds and you're misusing your voice, which could result in a voice disorder. Some strategies I use are easy onsets too, to reduce a hard glottal attack. A hard glottal attack when the vocal folds smack together. Some tense vowels can cause that. So for instance, if you say the word eat, E, you could smack those vocal cords together. Let's say it with a more gentle, calm voice. So heat. So you're adding extra breath support. You're breathing into it. It's almost like you're adding an invisible H to it. You're not saying heat, but heat. So you're speaking more gentle. And make sure you elongate those vowels in a calm way with extra breath support. And that's going to cause easy onset to voicing. Another thing I'll go into briefly is focusing on your nasal and your oral cavity also to bypass the pharynx. People with vocal disorders, a lot of times they sound very glottally. They speak from the level of the larynx. Don't be afraid. Breathe. Put the pressure on your lungs. Put the pressure in your mouth, the oral cavity, the nasal cavity. Bypass this area. It's a very sacred area where we need to protect those little rubber bands in there, those vocal cords. All right? We don't want to tense them. We don't want to cause any havoc on them. Be relaxed. Put pressure on the other areas. For example, if we're saying some nasal sounds with lots of M's and N's, like the word many, focus on the vibrations in the nose, or sometimes you could feel vibrations behind the teeth. Many. That will help take tension away from here. Try not to speak from the level of the throat. Take a deep breath, power the voice, and focus on the vibrations in the mouth and the nasal cavity while staying relaxed. And you know what? It's a lot to coordinate. We take this for granted. We don't think about all these things as we're speaking. I'm not thinking about my lungs powering my voice and the different resonating cavities. But that's the point in coming to voice therapy is education. A lot of voice therapy entails education, preventative measures, the hygiene, and the compensatory strategies. And then unfortunately, when we can't get through that and nodules still develop, we need to manage with strategies, relaxation, tension reduction, easy onset, breathing. So again, if you feel like you're having any voicing issues, you can in fact come to us and we will help. It's a lot of education and a lot to think about mentally, and it's lifestyle changes. It's not easy. It's not always easy to change the way we speak without sounding robotic. So we do take that into consideration when you're coming in for speech therapy or voice therapy, so to say.